Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas, and in today's class I am going to start with the gross anatomy of the upper limb. So in this slide you can see over here that first of all the different bones of the which are forming part of the upper limb are the clavicle, the scapula, the humerus, the radius and ulna, and the carpal and the metacarpal bones. So today we will do the axilla, and axilla is basically a pyramidal. It is a pyramidal shaped structure and it connects the neck with the arm. So this axilla has an apex. It has an apex, a base, a medial wall, anterior, posterior, and the lateral wall. Apex of the axilla is a triangular shaped structure. It's a triangular shaped space which connects the neck with that of the arm, and it is a truncated area. So it is bounded anteriorly by the Anteriorly, it is bounded by the clavicle. Posteriorly, it is bounded by the superior boundary of the scapula, and medially, it is bounded by the outer margin of the rib. So, in this slide, you can see that this whole area is the apex of the axilla, and this is a triangular space. It connects the neck with the arm. This whole area is also called the cervicoaxillary canal. So the base of the axilla is formed by the skin, the superficial fascia, and the axillary fascia. So I have told you the apex and base. Now 4 walls are forming the axilla. These walls are the anterior wall, the posterior wall, the lateral wall, and the medial wall. So I will show one by one. So anterior wall is formed by the pectoralis major muscle in front, and when we remove the pectoralis major muscle, we can see behind the pectoralis minor muscle and the subclavius muscle which are present over here. Pectoralis minor muscle and the subclavius muscles which are present. These are enclosed in clavipectoral fascia. So anteriorly wall is formed by the pectoralis major muscle in front, behind by the pectoralis minor muscle and the subclavial muscle. These two muscles are enclosed in the clavipectoral fascia, and they are forming the anterior wall. Now I will remove these muscles to show you the posterior wall. So here you can see, I remove this again. So here you can see the posterior wall which is formed by the, first of all, the subscapularis muscle, then the latissimus dorsi muscle, and in between two muscles, the teres major muscle is present. So these three main muscles, the subscapularis, the latissimus dorsi, and the teres major, these three are forming the posterior boundary of the axilla. Then moving on to the medial and the lateral boundaries. So medial boundary is formed by the intercostal muscles of the upper foreribs, and lateral boundary is formed by the short head of the biceps brachii along with the coracobrachialis. So this one is the short head of the biceps along with coracobrachialis. It is forming the lateral boundary. The medial boundary is formed by the intercostal muscles of the upper forerib. The posterior boundary is formed by the latissimus dorsi, the teres major, and subscapularis. And anterior boundary, as I have shown you, that it is formed by the pectoralis minor muscle over here, the subclavius muscle, and then the pectoralis major in front. So this is all about all of the boundaries and the apex and the base of the axilla. Now moving on to the contents of the axilla which are present over here. So first of all, you can see that this is the axillary artery, which is the artery and its branches, which is the first content. Then you can see the axillary vein and its tributaries which are present in it. Then you can see over here that the infraclavicular part of the brachial plexus and its branches are present in this area. Then you can see the 5 different groups of the lymph nodes which are present in the area of the axilla. So these are the contents of the axilla.